Introduction to Informed Consent.
Informed consent is a foundational principle in medicine, ensuring that patients have the right to understand and decide what happens to their bodies. It requires clear communication, transparency, and voluntary agreement, shaping ethical practices in both patient care and research. The concept as we know it today emerged from a pivotal legal case that transformed the doctor-patient relationship.
The landmark case, Salgo versus Leland, Stanford, 1957.
In 1957, the case of Salgo versus Leland Stanford Junior University Board of Trustees brought informed consent into the spotlight. After a patient underwent a procedure without being told of potential risks and suffered paralysis, he sued the hospital. The court ruled that physicians must disclose information a reasonable patient needs to make informed choices, setting a major precedent in medical law.
Before informed consent, early medical practices.
Prior to the landmark case, many patients were kept in the dark about their treatments. Doctors often believed that withholding information protected patients from anxiety. However, as awareness grew of patients' rights and autonomy, critics began to challenge this paternalistic approach, paving the way for a new era of communication and partnership in medicine.
Informed consent in modern medical practice.
Today, informed consent means more than just signing a form. Doctors must fully explain the risks, benefits, and alternatives of treatments, answering patients' questions openly. This standard protects patient autonomy and ensures that individuals can make decisions aligned with their values, especially in complex or high-risk situations.
Impact on research and medical ethics.
Informed consent is now a cornerstone of research ethics as well. Patients and study participants must receive all necessary information before agreeing to join clinical trials. This shift, influenced by legal cases and past ethical violations, safeguards individual rights and helps build trust between the public and the medical community.
Why informed consent matters.
Informed consent empowers people to actively participate in their healthcare decisions. It promotes respect, trust, and transparency, helping prevent harm and misunderstandings. The principle continues to shape ethical standards worldwide, reminding us that each medical decision should be a true partnership between patients and professionals.